There is a lot of misinformation on social media and on the internet about statins. I occasionally hear them from my patients, and I occasionally see comments like this on my TikTok, so let's take a minute to talk about this particular statement. There were some small observational studies and case reports that made this association, but remember, small observational studies and case reports are not a reliable source of evidence, and you can't use them to make your medical decision making. You need a better, larger analysis of the data to make a determination if this is true or not. There is no shortage of high-quality randomized controlled trials looking at statins. The European College of Preventive Cardiology published this large meta-analysis a few years ago looking at all these different studies put together. When you look at large data sets, multiple randomized controlled trials, and you put all that together, there is absolutely no association with the use of statins and early onset dementia. In fact, it's quite the opposite. The second most common form of dementia we see in elderly populations is something called vascular dementia, which is the result of atherosclerotic disease in blood vessels in your brain. And when you regulate your risk factors for atherosclerotic disease, which one of them is dyslipidemia, high cholesterol, and for example use statins to regulate that, you see less cases of vascular dementia later on in life. And here's another thing to keep in mind, that people are living longer and longer with cardiovascular disease. Folks in other generations may not have lived past 50 or 60, are living into their 70s and 80s because we understand atherosclerotic disease better, we understand risk factor management better, and part of that has been the use of statins over the last 3 or 4 decades that have really brought down the burden of morbidity and mortality when it comes to cardiovascular disease. So people are living longer and longer with heart disease and stroke disease, but what happens when you live longer and longer? You're going to see more of those neurocognitive diseases because more and more people are making it into their 80s and 90s. And part of the reason why they're making it longer into those decades is because of the use of medications like statins. And lastly, here's a summary statement from the Alzheimer's Society commenting on this particular question. They're citing a 30% reduction in Alzheimer's disease, a 7% reduction in vascular dementia because of statin use. You know, I can understand why an average person out there who Googles this topic gets dissuaded by whatever they see online, but what's really concerning about misinformation on this topic is that a lot of pseudo-medical experts, chiropractor, functional medicine doctors, wellness doctors, those types of folks are spreading this type of misinformation, and it's really frustrating and it's really dangerous.